maybe through direct contact, maybe through inhalation, maybe through any other route. So they may become sick, they may become ill. Other way is that when it is generated and sent to the environment because of mishandling of the waste. So whole of the environment will be having that waste, and people, general public coming in contact with that waste will also be infected. So that is the basic fundamental. So now we will start. So first is that what is healthcare waste, right? So it includes all the waste generated within healthcare facilities, research centers, laboratories, and OTs, and any place in the healthcare system will generate some waste will be generated, which is hazardous waste. Then it is also named as this infectious waste is named as biomedical waste. What is biomedical waste? It is any waste generated during the diagnosis. Diagnosis mean in the laboratory, if you are diagnosing some bacteria, virus, so one is that diagnosis. Maybe treatment. And diagnosis, maybe clinical diagnosis may also be there. The instruments used in the diagnosis and treatment. So in treatment, maybe some injections are given. So syringes may be the waste. So, or immunization, again in immunization vials and syringes of human beings or animals, or research activities pertaining thereto, or in the production of testing of biological or health camps, including the categories mentioned in Schedule 1 appended to the Biomedical Waste Management Rules 2016 as amended by Government of India. So all waste, either somebody is working on human beings or animals, or some research activities, all waste generated is named as a biomedical waste. So healthcare waste, if we divide healthcare waste, so 85% is a general waste, that is non-hazardous. Only 10% is infectious, that is hazardous. And 5% is again hazardous, but it's not infectious. It's a chemical radioactive waste. So this is a total quantum of waste. Most of the waste is non-infectious. So these non-infectious waste should not be mixed with the infectious waste. Otherwise, whole of the waste generated will become infectious. Then location of infectious waste. What are the locations in the healthcare system? Operating rooms, that are the waste generated in the operation theaters, like shops, blades are there, then chemicals used, disinfectants, linen used on the patient, gauze, body parts, etc. So maybe placenta may be there. So all these are blood and body fluids, if blood bottles are there. So emergency rooms, needles, syringes, blood bags, urine bags, IV sets, anything used on the patient in the emergency room. Then labor room again, almost same things, blood bags, placenta, dead fetus, because it's a labor room, placenta, dead fetus will be additional items, and soiled linens, infected gauze. Basic is that anything used on the patient. General wards, sharps, blood-soaked dressings, swab, infected blood and body fluids. Then in laboratories, especially microbiological and pathological waste, because in microbiological, bacteria, virus, and other fungi, etc. may be there. So the culture plates are there in which bacteria are grown. Then stalks of the cultures and glass slides used for the microscopic examination, again will be having waste. Then swabs used for the collection of some specimen. Then bins used to collect waste, if not labeled or segregated. It should be labeled that which waste is in which bin. And mixed waste, which contains different types of infectious waste and renders the whole waste infectious. So if you don't label it, and in a one bin, so even non-infectious becomes the infectious, because you are not labeling it, you are not segregating. So segregation of the waste is very important to minimize the waste, because segregation will tell us that this is the infectious waste, and non-infectious you don't have to treat, and that can be disposed of as it is. Then hospital linen or laundry which is contaminated with blood or body fluids. Anything which is contaminated with blood or body fluids is infectious. Then dental settings like shops used for dental practice, swabs used, infected teeth and blood. These are the locations of infectious waste, from which location you can get the waste. Then sources of infectious waste. So healthcare facility or its environment in ideal place. So any place in the healthcare facility may be source of infectious waste, like infections transmitted to the visitors by patients. Patients are visitors are coming to the patients, and so patient may transmit the infectious infection to the visitors by coughing, sneezing, or touching the physical environment. Like their visitor has come to the hospital and touching the physical environment like railings and door handles, that may have been some infectious material, so they may get the infection. And patients themselves have a lowered immunity. Patients have a lowered immunity because of disease, and hence are more susceptible to infections as compared to the general public. So standard precautions, if somebody not following standard precautions, then also it becomes source of infection. Standard precautions mean precautions should be taken while touching some infectious material. Gloves should be put. If you feel that infection may occur by inhalation, then mask should be used. Like in COVID-19, we are using the masks. So these are our sources of infectious disease. Then this is in healthcare setting, what are various sources of infectious waste. So hands of the healthcare personnel, because hands are very important. So hand hygiene is very important to control the infectious waste. Hands of healthcare personnel. Then contaminated equipment used on the patient. If some equipment is used, some scalpel blade or some scapula, or then some other material instruments used in the operation theater may be contaminated with and which are used on the patient. Then poorly cleaned surface and rooms. If rooms are not cleaned properly and surfaces are not clean, so that rooms and floors may be containing some infectious waste. The needles and other sharp instruments which are used on the patient, needles and sharp instruments. Then waste contaminated with blood or body fluid. Any waste which is contaminated with the blood or body fluid is infectious waste. Waste contaminated with feces, urine. So body fluids are there. Feces, urine of patient with highly communicable diseases. And then laboratory waste, anything used in the laboratory, like culture media and some chemicals used in the laboratory, that is laboratory waste. Then health risks from the infectious healthcare waste. What are health risks from these infectious healthcare waste? So number one is, who is at risk? So anyone coming into close proximity to the infectious waste, anyone who is coming in contact with the infectious waste, close to the infectious waste, may be at risk. And one who works at, provides or receives care at. So works at means healthcare workers who are working there. Provides or receives care at. Provides mean healthcare workers is providing, but receives, patients is receiving care. Or visitors of healthcare facility are at risk of infection. And those living around any facility delivering healthcare services, those persons who are living around any healthcare facility services are also potentially at risk from exposure, because environment may be not so clean, so they may be at risk. So risk to healthcare staff. So infections may be there to the healthcare staff due to blood and other infectious spills. So that's why standard precautions should be taken. So if a healthcare worker staffs are taking health standard precautions, then they may be safe from infections due to blood and other infectious spills. Then pathogenic aerosols, if aerosols, again standard precautions like N95 mask can be put. Then sharp injuries, again gloves should be there, so sharp injuries should not be there. Then risk to patients and visitors, so risk to patients and visitors are there, and visitors from patients, visitors can get, and even from visitors, if visitor is also having some infection, patient can also get. Patient may be having some other infection, but visitor has an infection and came in close contact with that can also transmit, vice versa. And risk to the community, general public is at risk of getting infection whenever hazardous healthcare waste is disposed of improperly. So if healthcare waste is not properly disposed of in the environment, so then general public is at risk. And so because ideally infectious waste should be treated first and then should be disposed of, and so to make it non-infectious. And improperly discarded medical waste in open bins, and like contaminated needles, so these are syringes, dressing, all are these infectious waste, and you are discarding in the open bins. And so in open bins in the public, which are they are in the public, so general public is coming in contact and having a risk of maybe injuries and infections. So in general public open bins, it should not be thrown out. Then risk to waste handlers. Waste handlers are who are taking the waste from the healthcare facilities and transporting it to some other place. So they are also, and they are collecting it, segregating it, they are at risk also. They are at immediate risk because of injuries from sharps, because they may get injuries from sharps and exposure to toxic and infectious waste, because they are collecting it. And additional hazard occurs due to squeezing at waste sites and due to manual sorting. They are sorting out manually and segregating. So that is also. So waste handlers should having a standard precaution. They should have a heavy duty gloves should be there, boots should be there, mask should be there. So all these should be put by them. Then mode of transmission of infection. It may be through infected air. It may be through direct contact. It may be through water contamination. It may be through fomites, and it may be through infected blood. So all are the mode of transmission may occur of infection to the persons. Impact of infectious healthcare waste on public health. Sharp injuries and infections. Like in hepatitis B, hepatitis C, HIV. In the year 2000, sharp injuries to healthcare workers were estimated to have caused about 66,000 hepatitis B infections. Hepatitis B is a virus, DNA virus, and then 16,000 hepatitis C RNA virus. All are these bloodborne. It may be bloodborne. And then 200 to 5,000 HIV infections among healthcare workers. So these are all figures of healthcare workers who are at risk, may get the hepatitis B infection, hepatitis B, HIV. And for healthcare workers, the fractions of these infections that are due to percutaneous occupational exposure, percutaneous, maybe because of a needle injury may be there. So needle stick injury may be there. So HPV is around 37% in healthcare workers, HCV 39%, and around HIV 4%. Then impact of infectious healthcare waste on public health. So one is antibiotic resistance may occur, and then ability of microbes to resist the effect of drugs. So this is ability of microbes to resist the effect. If antibiotic resistance is there, drugs will not be effective. And infections with resistant organisms are difficult to treat. If resistant or bacteria are there, they are very difficult to treat. Treatment is because drugs will not be effective. And this is examples of how antibiotic resistance spreads. So this is one person, George. George gets antibiotic and develop resistance bacteria in his gut. In his gut, he has got the resistant bacteria. So what happens then? So this example is of a human being. in this side example is for animals. So first going through the human being example. So he has got drug resistance bacteria in his gut. So what happens? So George stays at home and in the general community spreads resistance bacteria. He stays at home and in the general community he spreads the infection because he's there at home, and drug resistance bacteria is shedding in the feces. So community is at risk. So community gets. Other way is that George gets care at a hospital. Now another is George is getting the treatment or care at hospital, nursing home, or other in inpatient care facilities. So what happens that it may be that healthcare facility he is there and resistant bacteria spread to other patients. Like here it was in community. So he is spreading patient to other patients from the surfaces within the healthcare facility. They may get from the surfaces, or resistant germs spread directly to other patients or indirectly on unclean hands of healthcare providers. Healthcare providers have unclean hands. So patient go home. When patients go home, they are, if they are shedding that drug resistant bacteria, again they are spreading in the community. So this is the human being, how drug resistance may spread. Now coming to animals. So animal gets antibiotic, and animals get antibiotics and develop resistant bacteria in their guts. They also resistant bacteria like George, and now they have resistant bacteria in their gut. And so what happens? Drug resistant bacteria can remain on meat from animals, and when not handled or cooked properly, the bacteria can spread to the human meat. People are ingesting the meat which is not cooked properly, so they are getting the, this is one way. Then another way is that because they are shedding bacteria, drug resistant bacteria in the gut, in the feces, fertilizers or water containing animal feces. So animal feces is in the environment. So fertilizers or water containing animal feces and drug resistant bacteria are used on the food crops. So food crops, we are using water or fertilizer which may be containing the drug resistant bacteria. So drug resistant bacteria in the animal feces can remain on the crops. So because you are putting fertilizers containing the drug resistant bacteria, so it remain on the crops and be eaten. So they are eaten, and these bacteria can remain in the human gut. Again, it goes to the human gut. So this is a spread of antibiotic resistance, how it impacts of infectious healthcare waste on the public health. Then impact of infectious healthcare waste on health and environment. On health and environment. So categories of infectious waste, maybe sharps, maybe culture and stocks, blood and body fluids, pathological waste, selected isolation waste. Then location of infectious waste. It may be hospital linen, maybe there is laundry, dental settings, operation theater, emergency room. We have discussed already all this. Then source of healthcare waste. Again, we have discussed hands of healthcare personnel, contaminated equipment, dirty rooms, shops, laboratory waste, waste contaminated with feces and or urine of patient with highly communicable diseases, waste contaminated with blood and body fluid. Then healthcare facility harbor infections. Patients carry infections. Patients have a lower immunity. Healthcare workers constantly exposed to infections. Then management of healthcare infectious waste. So shops, cultures and stocks, blood and body fluids, and then pathological and placental waste, selected isolation waste, wastewater. So these are to manage so that one should not get the infection. Then impact of infectious waste, it may lead to infectious and antibiotic resistance may occur, and it may be infectious also to the other persons. And people at risk, and so healthcare staff is at risk, patients are at risk, community is at risk. And then prevention should be there, that one should, if even one comes in the contact of infectious waste, one should take proper precautions with the standard precautions, and so that patient or community persons may not get the infection. And policy programs should be should be there. So planning and training should be there to the healthcare personnels, and so they should not get this. Then hazardous nature of chemical waste. So now coming to chemical waste. This was all about the infectious waste, medical waste, biomedical waste. Now coming to hazardous nature of chemical waste, which is again a hazardous waste, non-infectious but chemical. And chemical waste consists of discarded solid, liquid, and gaseous chemicals from various diagnostics and experimental work, from cleaning and disinfecting procedures. So these some chemicals which are used in diagnosis in the laboratory and experimental works and for disinfectant purposes. So according to WHO, chemical waste generated from healthcare sector is considered to be hazardous if it has at least one of the following properties. If these properties are there, it is hazardous. If it's toxic, toxic means that fumes, dust, and vapors from the toxic material can be harmful as they can be inhaled and pass quickly from the lungs into the blood. So inhalation may occur and they may reach into the blood. And so these are the fumes, dust, and vapors from the toxic material. Then corrosive. Corrosive is strong acid and alkali bases are highly corrosive, and if splashed on skin or eye, can cause serious chemical burns. Serious chemical burns may occur on the skin or eyes because of a corroding nature. Then explosive. Flammable liquids can explode when ignited in confined spaces and can cause the uncontrolled release of compressed gases may be there, release of compressed gases. Then flammable, these compounds catch fire easily, so burn rapidly, spread quickly, and give intense heat. So again, this is hazardous. Then chemical reactive, these materials should be used with extreme caution and stored in special containers. Then globally harmonized system of classification and labeling of chemicals, how it is labeled, these chemicals. So GHS, that is globally harmonized system, defines and classifies the hazards of chemical products and communicates health and safety information on labels and safety data sheets. Like major element of GSR are classification of hazards of chemical according to GHS rules, and GHS provides guidance on classifying pure chemicals and mixtures according to its criteria or rules, and communication of hazards and precautionary information using safety data sheets and labels. What are labels? So labels are put on the chemicals. So with the GHS, certain information will appear on the label. What is this information? For example, chemical identity, what is that chemical? Standardized hazard statements, what hazard may occur, and symbol, what is symbol according to the classification of these that chemical or mixture. These are the various symbols which are used on these. Like first is corrosion is there, and on the label it's written that what effect may occur, like skin corrosion may be occurring, burns may be there, eye damage, corrosive to metals. Then this is exploding bomb, like explosive, self-reactives, organic peroxide, like this environment, the aquatic site toxicity. This is in the aquatic, in the fishes and the in the aquatic, it may be harmful to the animals. And this health hazards, it may be carcinogenic. Health hazard, this sign shows the health hazard. It may be carcinogenic, respiratory sensitizer, target organs toxicity, these mutagenicity may be there, and reproductive toxicity may be there, aspiration toxicity may be there. So this is gas cylinder, gases under pressure. So this flame, it will may be written there that it is flammable, it may be pyrophorics, self-heating. So these are the just examples of some labels. Then chemical waste from healthcare activities. There are various chemical waste, like acids which are maybe used, like acetic acid, boric acid, chromic acid, hydrochloric acid, nitric acid, sulfuric acid. There are various chemicals used for various purposes in the laboratories and other research purposes. Like alcohols are used, ethanol, isopropanol, phenols. Then aldehydes, chlorhexidine, formaldehyde, glutaraldehyde. orthomethylaldehyde, then bases, ammonium hydroxide, potassium hydroxide, sodium hydroxide, then halogenated disinfectants like calcium hypochlorite, chlorine dioxide, iodine solutions, iodophores, sodium hypochlorite. This hypochlorite that is bleach, this hypochlorite solution is very commonly used in the hospital as a disinfectant, especially in the HIV laboratory. And for HIV purposes, it is very effective disinfectant hypochlorite solution. And these iodophores are also used for the in the OTs and other places for disinfection of the skin and for so this is also disinfectant, a good disinfectant. Then halogenated solvents like chloroform, methylene chloride, these may be used in the OTs. Then metals like arsenic metal, cadmium, chromium, lead, mercury, silver, these are also silver was used in the dental practice. Then mercury was used in the thermometer and BP instruments. And lead is also used in the radiology department, lead sheets. Then non-halogenated solvents like acetone, ethanol, ethyl acetate, formaldehyde, isopropanol. Then other disinfectants like hydrogen peroxide is also used, and peroxy acetic acid. These are very good disinfectants. Quaternary amines is there. Hydrogen peroxide is used. Then oxidizers like bleach. Again, we have talked about bleach. So bleach, hydrogen peroxide, potassium dichromate, potassium permanganate, reducers, so sodium bisulfite. So these are the some examples of chemical waste. Then impact of toxic chemicals on health. So these chemicals can cause maybe toxic. So intoxication may occur either by acute or chronic exposure. And physical injuries like burns may occur. And injuries to eyes, skin, or mucous membranes of airways can occur by contact with inflammable, corrosive, or reactive chemicals. So this is one example is given that a mother can pass as much as 33% of her chemicals body burden to her child. So 33% of her chemical body burden can be transmitted to the child. So mother can pass. And 232 toxic chemicals were found in umbilical cord blood from US newborn. So this is one. And this is the example how many cases are there. So 4.9 million deaths were attributed to the environmental exposure and management of selected chemicals. Like this is the 4.49 million environment. And HIV/AIDS 2 million deaths were there. And tuberculosis 1.5 million. And traffic accident 1.3. And malaria is 0.9. So this environmental is lot of more number of deaths are there rather than various diseases. Then coming to mercury as a chemical. Mercury is found in three major forms in the environment as methyl mercury, elemental or metallic mercury, or can be bound to other compounds. So what are sources of mercury in healthcare settings? Thermometers, sphygmomanometers, dental amalgam, esophageal dilators, laboratory chemicals like fixatives, stains, reagents, preservatives, batteries for medical use, fluorescent lamps, electric equipment, pressure gauge. Then what are effects of mercury on the environment? Most of the mercury found in the environment is inorganic, since mercury is never broken down into another chemical and harmless form. It is not broken into another form which is harmless. So it's a environment, it's a lot of effect. And mercury permanently exists in the environment by changing its chemical form depending on the environment. Flushing should not be done. Flushing in sewers and dumping in municipal waste bin endangers the whole environment. So it should not be put in the sewer or dumping should not be done. And 1 gram of mercury contaminates a 20-acre lake with enough mercury to cause poisoning of fish. So poisoning of fish may occur in a 20-acre lake with only 1 gram of mercury. Then effects of mercury on health. So methyl mercury has a capability to interfere with cell division, or cell division may be effective. It can cross blood-brain barrier and placenta. So if blood-brain barrier it can cross, then it can reach brain and placenta. And pregnant women and children are most vulnerable to effect of mercury because it can pass through placenta. Mercury is a potent neurotoxin. It can affect the nervous system. And even at very low levels of exposure, it can cause permanent damage to the human central nervous system. So our nervous system, central nervous system may be affected. And so it's a neurotoxic. And at high concentration, a higher concentration, mercury can damage vital organs. It can damage important organs like lungs, liver, and kidneys. Then management of mercury exposure in healthcare settings. How to manage a mercury spill? If mercury spill has occurred, how to manage? So you have to put protective gloves and mask to reduce the inhalation. So the person who is managing it should put the gloves on the hands and mask to reduce the inhalation. And increase ventilation by opening window. The window should be open. Switch off all ACs in heating mode, and that use 2 pieces of firm straight edge plastic sheets. So 2 plastic sheets have to be taken, 2 pieces of plastic sheet which have a straight edge, and slowly guide the droplets together into a pool. So by 2 plastic sheets, you have to droplets of the mercury can be taken. And another way is use glass pipette with rubber ball to suck up the mercury. Mercury can be sucked up by the pipette and with the rubber ball, and to collect it in a glass or plastic bottle. In a plastic bottle, you have to collect it with the pipette with a tightly fitting lid. And you may also use syringe without needle. Without needle syringe, you can also take that mercury drops and put it into that plastic or glass bottle with the lid. For picking up tiny droplets, for very tiny droplets are there, you sprinkle zinc or sulfur powder on the floor. You put zinc or sulfur powder on that floor where tiny droplets are there, and collect all mercury content as per the above procedure. Above procedure means either you use the syringe or with the pipette or with the that plastic sheets, and label the bottle with mercury waste. Label that bottle in which you are collecting mercury waste, and all mercury contaminated mercury items kept in a polythene cover as hazardous waste. You put that bottle in a polythene cover and label it as a hazardous waste. And tightly close the container, clean the mercury spill area with sodium thiosulfate, and collected mercury waste as well as all contaminated items should be disposed of. All should be disposed of, like gloves and other mask, etc. Lead. Sources in healthcare settings. What are sources in healthcare setting of lead? Major sources of lead from healthcare waste are dental amalgamation, where lead foils are used, traditional X-ray packets, and lead aprons used in the radiology department for protection, lead acid batteries, and lead paints. Effects of lead on the environment. Lead X-ray packets result in the contamination of soil and groundwater in landfills area after disposal. And environmental pollution can occur when non-hazardous general waste containing lead from healthcare institution is incinerated or burned in open kilns. If it's incinerated or burned, so it will be general waste, maybe containing the lead, and you are burning it or incinerated, then environmental pollution occurs. Water pollution may be due to erosion of lead from lead water supply pipes. Lead water supply pipes are there, then it may erode from there and water pollution may occur. Disposal of lead containing pharmaceuticals in the sewer. If you are disposing of pharmaceuticals in the sewer, give rise to groundwater pollution. So lead containing pharmaceuticals. Effects of Z on health. Exposure to Z can cause effect on blood, nervous system, immune system, renal, and cardiovascular systems. So it may affect very vital systems. And exposure to high amounts of Z can cause gastrointestinal symptoms, damage the brain and kidneys, and cause reproductive effects. Children less than 6 years of age are at maximum risk. The organs affected are bones, brain, heart, kidneys, liver, nervous system, and pancreas. So all these are important organs. Other heavy metals. Other heavy metals may be aluminum, antimony, arsenic, barium, beryllium, nickel, cadmium, cadmium, chromium. So fuel gases from incinerators are reported to release all the above heavy metals in different composition depending on the waste stream. So even fuel gases may be there from the incinerator of these. Then coming to disinfectants. Disinfectants are used in the hospitals, routinely used in the hospital for cleaning purposes and for in the even in the OT, even in for the general dressing, and so many places disinfectants are used. On the hands also it is used, and these chemicals are very toxic, and their exposure could lead to serious health issues. And commonly used disinfectant in hospitals are formaldehyde, glutaraldehyde, sodium hypochlorite, phenolic chemicals, chlorhexidine, cetrimide. Formaldehyde. It is used as a sources of formaldehyde, as a formalin is used in embalming bodies in the anatomy department. It's used in for dissection also it is, and for the preservation of specimen in pathology and anatomy museums, because you want to preserve the specimens, so you put it into the formalin. And it is also used as a fixative for histological specimens. For fixation also, the histological specimens fixation is done. Effect on in environment. As it vaporizes easily, most of the formalin is found in the air. So because vaporization is there of formalin, so formalin is very irritating. If you must have experienced some places, if formalin is there, fumes are there in the environment, and it becomes irritating. And so it's, if for even for inhalation, it will be very bad. And so it's in the environment, comes in the environment by vaporization. Effects on the health. Falling inhalation to low concentration causes conjunctivitis. Conjunctivitis may occur, sore throat may occur, coughing and difficulty in breathing may occur. And in the body, it quickly breaks down into other chemicals which pass out of the body through the excretory system along with urine. So these are the various effects of formaldehyde. Then coming to glutaraldehyde, very commonly used in the OTs, and that name as the name of the Sidex is a trade name official, that colorless oily liquid available in the market as Sidex or Tocoxide and ASAP. And uses of glutaraldehyde in the healthcare settings, it's used as a cold sterilant. Cold sterilant because sterilant is which can kill all bacteria, viruses, other fungi, including spores. And cold because there is no temperature raising in not there, temperature is not increased, so it's a cold sterilization process. And a tissue fixative, it can be used as a tissue fixative in histology and pathology labs. An embalming solution can also be used like formaldehyde in the preparation of grafts and bioprocesses, and used to disinfect equipment that cannot be heat sterilized. So because it is a cold sterilization, some equipments are there you want to disinfect, but they cannot tolerate heat sterilization. So this will be used like a dialysis instruments. You can't use a sterilization process, heating sterilization process. So cold sterilization process is used. And some surgical instruments like bronchoscopes, endoscopes are all are disinfected by this, sterilized by cold sterilization by glutaraldehyde, and used in operation theaters, intensive care units, and wards for disinfectant purposes. Very commonly used disinfectant. Then effects of glutaraldehyde on environment. It affects health workers during the pouring of glutaraldehyde solutions into a sink or toilet due to exposure to glutaraldehyde vapors. Again, vapors may be there, one can inhale the vapors. An effect of glutaraldehyde on health, it may irritate eyes and respiratory tract and has a corrosive action on the conjunctiva and skin. So corrosive action may occur and may cause permanent injury to eyes and can cause severe allergic skin reactions. On the skin, it can give the skin allergic skin reactions, dermatitis, nasal and throat irritation, and it may also lead to headache, cough, and asthma-like conditions. Then coming to sodium hypochlorite, another disinfectant we very commonly used, especially in HIV laboratories, and even for body and blood fluid spill, blood and body fluids spill. It is very commonly used, sodium hypochlorite, and most widely used chemical disinfectant in healthcare settings and household due to its disinfectant efficacy and affordability. Very effective disinfectant. And sources, disinfectant for spill management. As I said, spill, any body and fluid or blood spill is, if occurs, you have to use this sodium hypochlorite solution. And disinfecting bed pans and sterilization of non-autoclavable instruments. Again, non-autoclavable mean non-heating, because autoclave is a heated type of sterilization. Autoclave is an instrument in which heat is used. So if which instrument which cannot use heat as a sterilization process, in that it can be used, like endoscopes. And disinfection of infected plastic syringes before disposal. If you want to dispose of plastic syringes, hypochlorite solution can be used. Then effects of sodium hypochlorite on the environment. It, it does not produce any substantial ecological disturbance. And effects on the health are there. It is not a mutagenic, carcinogenic, teratogenic, or skin sensitizer, but irritates eyes and respiratory tract and has a corrosive action on the conjunctiva and skin. Headache, cough and throat irritation may occur. Asthma-like condition may occur. And on ingestion, it can cause nausea and vomiting. Then best practices for management of hazardous chemical waste. What are the best practices? The best practice is that minimize use of these disinfectants and proper disposal should be there. What are the minimization options? How to minimize it? So substituting highly toxic, which are highly toxic material, which that should not be used. Substitute something else. And environmentally persistent cleaners and solvents with less toxic alternative should be used, and which should be environmental friendly chemicals should be used. This is one, that substitution. Using minimum concentration where possible. Where minimum concentration is effective, then that can be used. Ensuring good inventory control, that just in time purchasing, that it should not be take and store the disinfectant. And designing storage area well. So storage area should be also designed properly. Integrating pest management. Pest management should also be there, because if pests are there, they can also spread these by cutting the bottles, plastic bottles, and so they may be lead to some spread of disinfectants. And keeping disinfecting trays covered to prevent loss of evaporation. So trays should be covered to so evaporation should not be there, and so no disinfectant should be there in the vapor form in the environment. And developing spill prevention and cleanup procedures. So one should know that if spill occurs, how to prevent it, and what are the preventive measures, and how to clean up also procedure should be known. And recovering solvents using fractional distillation. Disposal suggestions. Now next is how to dispose hazardous chemical waste of different composition should be stored separately. Hazardous chemical waste of different composition should be stored separately based on compatibility to avoid unwanted chemical reactions. So chemical reaction should not be there. So different composition should be stored separately. So two chemicals should not react with each other, and explosion should not be there, or to avoid fire hazards. And storage area should be provided with fire safety provision should be there in storage area, because if fire occurs, then fire safety provision should be there. And large amounts of chemical waste should not be buried because they may leak from their containers. Large amount of chemical waste should not be buried because they may leak from their containers, and then problem the environment. Large amounts of chemical disinfectants should not be encapsulated, as they are corrosive to concrete. Encapsulation is done in the concrete. So concrete material is there in which encapsulated is there. So they may be corrosive to concrete and sometimes produce flammable gases may be there which are harmful to the environment. And unused hazardous chemicals can be returned to the original supplier. If you have an unused hazardous chemical, that should be returned to the original suppliers. And all hazardous waste should be disposed of in accordance with the applicable hazardous waste management rules. And disposal of photochemicals. Photochemicals should be collected separately. And first recovery of silver from photoprocessing wastewater should be done using cation exchange, electrolyte recovery, or filtration by authorized recycler for recovery of silver. There are authorized recyclers should be given for recovery of silver. And spent solution after neutralization should be stored for a minimum of 1 day and then sent for further treatment through ETP. Thank you. Basic idea of this lecture was that one should be aware of how this biomedical waste and other hazardous waste may be harmful to the persons in the community, to the healthcare workers, and in the environment, because whole community is living in the environment. So if environment is not proper, more and more persons will become sick and will be having more disease burden may be there. So and even for the patient also it may be harmful, for the healthcare worker also it may be harmful. So that was the basic idea. That's it. Thank you very much. If any question, you can talk and discuss. Hello. Hello. Hello.
Sir.
I'm audible?
Yeah, audible.
Okay. And now next lecture will be at 4, I
Yeah.
think.
Any question to sir, students?
Any question we can
If you
discuss?
have any doubts or have any query, then you can ask your question to sir. Is there any doubts, learners?
How many participants are there?
I think 12.
Okay. We did not have introduction, right? Even I did not talk. I just started immediately. What's your name?
My name is Dr. S.K. Paningrai.
Mm-hmm.
I am Deputy Director in RC Bhubaneswar.
Okay, okay, okay.
So actually, I introduced you that time. Maybe I think
I
you.
know. I remember that.
Yeah.
And can we have introduction to other persons also, participants?
Participant learners, can you introduce yourself?
Sure, sir.
Yeah. Go ahead.
Surinder Sani?
Yes, sir. Surinder Saini from Junjunu, Rajasthan. I am a hospital pharmacist, government pharmacist, and healthcare facility in Rajasthan. And previously, I completed my post graduation in hospital and health
Okay.
management from IGNOU. Now I am pursuing my certificate in healthcare waste management.
Okay. You have already done one course from IGNOU.
One course. Actually, my main motto is to complete it, and later I will want to join facility as a instructor or as a advisor on the healthcare waste management. And one more program is continued by the state government Kayakalp in Rajasthan. Mainly, basically, it is completely depends on healthcare waste management. And one more
Hmm.
is on national level there is a campus program is also running out.
Okay.
That's
Good.
why
Hmm.
I planning to join these two
Okay.
programs.
Okay. Good. Very good to learn about
Thank you,
it.
sir.
Next, Jobby Biju. Anyone?
Kindly introduce yourself.
Any Gagandeep Kaur, Jobby Biju. You are not audible.
Me.
No, no. This IDSP
Yes,
Kalahandi. Uh,
I am Dr. Rakesh Kumar Sahu,
okay.
District Public Health Officer, Kalahandi, Odisha.
Okay. Next, please.
Sir, myself Dr. Prabhat Kumar Ratha,
Mm-hmm.
DMOMS for Medicinal Superintendent, District Headquarters Hospital,
Mm-hmm.
Bolangi.
Okay. Good. Nice. Next. Anyone?
Sir, I am Dr. Sudhiranjan Nayak, DMMS, JHS Nuapada, Odisha.
Okay. Next one. Anyone left? Anyone can speak? How many persons you told me that how many
12.
participants? 12. Oh,
Exactly.
okay. Must be 4 5 we have introduced,
Yeah.
but others may not be there. May not be
Yeah. I
there.
mean, they're in. I mean, it's
They may
showing
not
in
be.
the list, but they are not
They
coming
may not be
online.
there on this. No? They
Yeah.
are showing
Maybe.
it, but they are gone somewhere. Right. Right. Then thank you very much. Hmm?
Thank you very much, sir.
Oh,
We are
okay.
Thank you,
really
sir.
thankful to you. Out of your busy schedule, you have presented an excellent presentation because may not be we are not from your field, but what
Mm-hmm.
are the presentation you've done? And I had since last 1 hour and for 50 minutes, I'm hearing your presentation. It's really
Mm-hmm.
excellent presentation.
Uh,
Thankful. I mean,
Thank
really,
you very
IGNOU is
much.
thankful to you, and many thanks and thankful to you, sir.
Thank you very
Thank
much,
you very
Dr.
much.
Panigiri. Thank you.
Okay, sir.
Oh,
Thank you.
oh,
Okay, learners, you will have a just 1-2 minutes break. We will wait for Dr. Suman to join for the next class. So we will start our class. Now our next class is disposal of BMW. So ma'am will join at 4 o'clock. So by that time you will take your tea. So we will start our class on 4 o'clock. Dr. Suman will phone.
So good afternoon, sir. This is Dr. Suman here.
Okay, ma'am. I
Okay.
mean,
You are waiting for
you're,
me, sir.
yeah, I'm waiting for you, ma'am.
I am sorry, sir. I was
No
stuck
issue.
in a meeting.
No issue. Just now only sir has finished the class.
Okay.
So I really thanks to you. Mane, no doubt you are a very busy person.
Nothing.
So we'll wait for 1-2 minutes because just now finish and I told to the students when I mean just we'll wait for one because take a break for 2 minutes. Then
Okay.
we'll start our class. Okay.
Okay, sir.
So students, are you ready? Just will I will take the view of the students.
Okay, then
We are
we'll
ready,
take
sir. No problem.
a.
Yes, yes.
All are ready, sir? Or you will take for 1-2 minutes break?
Ready,
Yeah,
sir. No
ready, sir. You
problem.
can start.
Ready? Okay, okay, fine, fine.
Okay.
So, I mean, I welcome to today's session. I mean, already one session is over because our next session is Dr. Suman, who's already taken the class yesterday. So today he's going to discuss about the disposal of BMW. Am I right, ma'am?
Yes, sir.
So no doubt, ma'am is very busy. He's a very active work. I mean, he's on the meeting. He straight away come from the meeting. So I welcome you to today's session, ma'am. And I hand over the session to you. I just welcome you from the on behalf of RC Bhubaneswar, on behalf of the IGNO New Delhi, because it is a all over India students have joined because throughout the India, whatever they have taken this program. So centralized, you are doing the online counseling classes. So I just welcome once again you for today's session. And I hand over the session to Dr. Suman.
So thank you, sir. Are my slides? Am I audible first?
Yes, I audible.
Yes, ma'am.
Are my slides visible, or is the window any other window that is visible?
Window is visible, ma'am.
No, is the slide visible?
No, ma'am.
No. Huh? I'll just. I'll try and share it once again, sir. Sir, are the slides now visible, sir?
Yeah, ma'am. Now is visible.
I'll just change the slide and see if it is changing.
Yeah, final treatment and disposal option.
Okay. Is it changing, sir, this slides?
No, ma'am. Slide is not changing.
Slide, I'm actually having it in the, I don't have it in the presentation mode. It's not changing, sir, now. Has it changed
No, ma'am.
to objectives of the session? No? Okay. Should I stop sharing and then do it once again?
तपन recording बंद कर दे और स्टार्ट करो.
Now is
Good
it
class
visible?
ना.
Are the slides changing, sir?
Now it is changing, ma'am.
सब दिन
Changing?
continue होची.